the approaches and the mechanisms are really, from acupuncture and naturopathic support, they're very similar in terms of what are our goals. Like there's blood flow, there's the immune response, and then there's also the individual who you want to support in terms of stress, any kind of emotional support that someone might need, right? So I think that's really important as well for many reasons, just for a person's ability to get through a difficult time or for fertility journey, but also looking at more the physiological effect that stress and stress hormones can also be having. So that's even kind of multi-layered approach as well, right?
Welcome to the Advanced Women's Health Podcast, where we empower women with the latest insights and advice on holistic health. From cutting-edge medical research to practical wellness tips, our mission is to help you thrive at every stage of life. Join us as we explore topics ranging from hormonal balance and reproductive health to nutrition and mental well-being. Whether you're seeking solutions for a specific health concern or simply want to enhance your overall wellness, you're in the right place. Let's embark on this journey to better health together. This is the Advanced Women's Health Podcast. Hello, everyone, and welcome back. Today, this is part 2 of our endometriosis and fertility conversation with Dr. Lauryn Dingwall and Sean in Kingston. I am so excited to dive into this conversation. If you have not listened to part 1, we got into the nitty-gritty of what is endometriosis, what can be some of the causes of it, the things we don't think about. And today we're really focused in on treatment. This is something that I mentioned last time that we all got a good laugh about, but we really pride ourselves on collaborative care because we are the best. No, I'm joking. But we really do want to create systems and structures for you to be successful. This is all the way from patient onboarding coordinators and people helping you set goals and to understand the principles of nutrition, straight through to creating collaborative structures so that we can talk about your care and that we can ensure that you guys get the best result. Fundamentally, health doesn't happen in a silo. It happens with practitioners grouping together to support each other and to support you. And on the business side of things, because I know people listen, one of the things in analyzing our patients who had the best success, who gave the best feedback, was these were patients, for the most part, that saw multiple practitioners. So they got care from multiple people on our team that were focused on the same goal, whether that's an osteopath and a naturopath, or whether that's an acupuncturist and a naturopath, or a psychotherapist and an osteopath. It doesn't really matter. But what we found is that when people were supported holistically from multiple different perspectives, they fundamentally got better results. And that's something that I'm very passionate about bringing into our practice in a bigger way, is because we all want patients to get better faster. Like, I think we all have the same goal, better faster. And if we have all of the tools under one roof that can do it right now, then we just really need to build that ecosystem so that everyone understands what opportunities they have available. So anyways, that's a topic for another conversation, but that's really spurred on why we're having these collaborative conversations and also why we're rolling out more programming that includes multidisciplinary, because fundamentally people are getting better results. So without further ado, when we're treating endometriosis, I think one of the really important perspectives that I always emphasize in my patient visits is that there are 5 to 7 causes of disease, not more, not less. Like, this is what it is. Health is simple. We make it very complicated because we assign a lot of different things to it. And I think that's why I also love the TCM approach, because it's very similar, right? It's like there are only so many systems of the body. You can have 10,000 diagnoses, but there's only so many systems of the body. And the research is proving that to be true more and more and more. So when we get into it from a naturopathic perspective, from a functional medicine perspective, endometriosis is a condition that has challenges in each of these pillars. So we see challenges with growth factors. So one of the big ones being insulin and blood sugar dysregulation. We see challenges with the immune system and inflammation. We see changes in the gut microbiome, the uterine microbiome, the vaginal microbiome. We see liver dysfunction, and post-viral hepatitis comes up quite a bit. We see significant nutrient deficiencies, mitochondrial issues, and energy production. We see changes in how the body is able to produce energy, to burn energy, and that plays into pain pathways. And then fundamentally, we see changes in the nervous system. When you are in pain, when you have mood changes, when you have unpredictable symptoms around your period, when you have just a condition fundamentally, honestly, after you've been diagnosed, whether it's affecting you on a day to day or not, it affects your nervous system. It affects your feelings on a day to day basis. As someone who, again, has dealt with chronic pain, like I can literally feel when my SI joint shifts. And it takes everything in my body to not have a stress response, right? To be like, it's going to be okay. You're not going to go into pain. Like, there's so many things that come up with that. Even we were talking about this weekend, I was going to the zoo and I was like, well, I have my period. You know what I mean? What's it going to be like this month? Am I going to be in pain? Am I not? Am I going to? And I was fine, fortunately, but you can't rid yourself of that, which ultimately affects your nervous system. So that was super high level, but I would love, Lauryn, for you to dive in a little bit first on your thought processes when you are looking at endometriosis and supporting patients with that.
Yeah, I think one of the first things that we always kind of work is assessing kind of what is, I guess, the intensity at which those symptoms are impacting quality of life. And it gives us a little bit of information. Do we need to stabilize first? So do we need to calm inflammation? Do we need to stabilize the immune system? And histamine comes up a lot in regards to that, or kind of how we need to kind of support some of those really specific pathways that we know are involved before we can kind of, or we kind of use a judgment call. Do we think the system and this person and this kind of all of those factors they can handle going into some of those, like a bacterial trigger or a viral trigger, going right into those treatments? Or there's a potential where if we go right into that right off the bat, but we don't stabilize the nervous system and inflammation and histamine, sometimes we can flare things before they get better. So sometimes we will combine all of those things in one treatment, or in kind of one starting plan, and we just say, okay, let's give her hell essentially for a period of time, especially in the fertility context, is when we're supporting, or I can speak for myself, when I'm supporting an individual in that situation, sometimes like there's such a highly motivated population that sometimes how we navigate kind of to move forward with treatment or what that assessment, depending where they are in their fertility journey, a lot of them have been through the ringer already and they're just like, let's go, like throw things at me, like let's get traction, and like trying month after month, they're just like, okay, like ready to go, which is a very different situation than someone that might come in that we suspect has endometriosis, but fertility is off the table. Like how we navigate the intensity, I would say, or like the number of treatments that we layer in right off the bat, kind of from that perspective. So that's kind of first things first. It's like, what's happening with inflammation? Do we have to do anti-inflammatory support? So we use a lot of proteolytic enzymes, I would say, as like one of the main kind of modalities that we think about to kind of calm inflammation. Do we need to stabilize histamine? Do we need to add in an antimicrobial? We do know that there's higher levels of bacteria in the peritoneal fluid for those with endometriosis, specifically those gram-negative bugs. So are we using herbs that have those antimicrobial properties? Or if something we think there was a viral trigger, do we choose an antimicrobial formula that has both some concomitant antibacterial properties, but also antiviral? Or for some of our patients, they'll have a never well since a viral infection. So we've seen that a lot as well, that we might go stronger antivirals right off the bat versus kind of that gut microbiome piece. And then the nervous system comes up.
I'm going to pause you there, actually. Yeah. So I'm going to take a little of Lauryn's brilliant brain and break it down into something that you guys can use. Yeah. This is what happens when we talk to doctors all day long. So when we're going and like breaking that down into smaller pieces. So one of the first things we talked about was histamine. We have a bunch of episodes all on histamine, but essentially, so that you don't need to go listen to the whole Encyclopedia of Advanced Women's Health, histamine is something we think about with allergies. Okay. It actually can cause allergy-like symptoms before someone gets their period. Brain fog, headaches, mood changes, runny nose, itchy eyes, itchy skin. I got hives before my period a couple months ago, and I was so mad about it. I was like, come on. And it's not a lot, but they were just like pressure area hives, right? So that it can show up like that. But part of the swelling, and we were talking about this on our clinic grounds call this morning. One of the girls was like talking about a patient who got so swollen that they felt like someone could pop them. And I'm like, well, are they farting? Because if you're passing gas, okay, that's a balloon that you could pop. But for so many of our patients with endometriosis, it's actually fluid. So if you get a bug bite, what happens? It swells. If you get a bee sting, what happens? It swells. If you have an allergic reaction, it swells. So too can your whole abdomen. You pull water in. That's why people say, I look 9 months pregnant, 8 months pregnant. It's not that they're full of farts. It's that they actually, the fluid there has created so much inflammation. And so part of that is a histamine response.
And is that, sorry to interrupt, but is that
No,
essentially
that's great.
like an immune response as well? Like your
Yeah.
immune system is just becoming more engaged?
So what happens is we have these like our little soldiers on the front lines. They're called mast cells. Okay. And their job in the immune system is to say, you shouldn't effing be here. They don't know what it is. They're not specific. So they don't know what they're fighting. They don't know if they're fighting a food. They don't know if they're fighting an endometrial like cell. They don't know if they're fighting a virus, bacteria. They don't know what they're doing.
They just
But they're just like,
recognize that, yeah, they just recognize something's not right.
exactly, you shouldn't be here. And so what happens at that point of the cycle is that estrogen and rapid flux, so either high estrogen or rapid changes in estrogen trigger those mast cells to be even more sensitive. So they're even more, I always say to my patients, I'm like, you know how bitchy you feel before your period comes? Your mast cells feel the same way. Like the breathing ticks them off, the chewing ticks them off. No, I'm joking. But like anything, they will be more sensitive to that, and we will create more of a histamine response. And you actually, the endometrial lesions will create a histamine response as well. And so you get the swelling, but it also increases the perception of pain in those areas. It's crazy.
And well, one thing that comes up in terms of how acupuncture works is that it has a regulatory effect on this like cytokine response. And I'm just wondering from your perspective,
Totally.
like how is that connected with histamine and the immune response? Just the like the
So,
cytokines and the different balance with the T helper cells and whatnot.
yeah. So, oh, we're going nerdy.
I know.
Let's go in.
Help yourself, Sean.
Lauren's
Well,
like, you thought I was a
it
nerd.
comes up.
So,
It comes up a
I was
lot.
like, I didn't even pull out those words yet.
I know.
but it's a good point. So cytokines are simply messenger, like communication messages within the body. Okay. So it's essentially telling different aspects of the immune system to either upregulate and be more active or downregulate and be less active. So what Sean's talking about is like T helper cells. So there's Th1. Okay, which is essentially, we think about that as autoimmune. This is if there's something inside of a cell and we need to kill it, Th1 type cells go in to kill it. So they blow it up. So this is autoimmune. This is your body attacking itself, trying to rupture a cell to get at and kill what's in it, thinking virus, etc. Okay. Then we have Th2, which is typically parasites, pregnancy. This is what happens to allow the body to create an immune response, but not attack or kill something directly. And then there's a new type of immune response. It's not new. Nothing is new in the human body. But, anyways, there's a type of immune response getting more attention called Th17. And essentially, it is the middleman. So it is causing a damaging histamine response.
Okay.
And that is very active in endometriosis. And what we want to get to is regulation. These are called T regulatory cells. We want to attack a virus if it's there, but not attack our own cells. We want to have an antibody response if it's appropriate so that we can eliminate any parasites, that we can take care of an allergen, but we don't want to have it on all the time. We want flexibility. And so what happens in endometriosis is you get stuck down one pathway, which is essentially this like attack and surround pathway. The Th17 pathway gets very activated. And then acupuncture is working to create more of that fluidity, that balance. It's saying, okay, let's not get stuck in one direction. Let's be able to work efficiently and effectively.
Yeah, no, I think it's a really interesting investigation that's come out is that it's creating a balance between the Th1 and Th2, like just creating a better environment for your immune system to just not create that inflammatory response, I guess, right?
Yeah. Yeah. And to be able to be more fluid, right? Like that's the beautiful thing. We use a lot of what we call adaptogens in naturopathic medicine, right? Meaning it's giving the body the opportunity to like have more resilience and to be able to do what it should do when it should do it.
Well, yeah, and
You don't want
this
your
an
cortisol to.
adaptogen is very much like a, I don't know, it's very much in the zeitgeist right now. Like people throw that word out there,
Oh yeah.
right? And but like, could you just really quickly define that for me so that I can just sort of understand that a
Yeah.
little bit better?
Yeah, everyone listening to this podcast is like, go, Sean, go.
Well,
Sarah and Lauren would take us way too far down this. So, an adaptogen, it's a wonderful question. I love having conversations like this. So an adaptogen is literally, and let's use cortisol, for example. A lot of time that's where the conversation is adaptogens. What it's doing is essentially preventing cortisol from going too high or too low. So it's not forcing a hormone or the immune system in one direction or another. It's saying you have the ability to appropriately flex between these two boundaries, right? So it allows the body to create resilience. The definition of resilience that I have decided to take on is how fast you get back to normal behavior or normal physiological function. So if I get stressed, how fast do I come back down between, for anyone who can't see, I'm just using my hands as like two little boundaries or two little bumpers in a bowling alley. But within that, how fast do I come back to normal between those lines? And when you're not taking adaptogens, it might take you, whether that's an immune adaptogen, it might take you 4 weeks to recover from a cold, or whether that is a stress adaptogen, it might take you 3 days to recover from a stress or a poor night of sleep. When we look at the use of herbs, it's helping to compress that timeline. So you get back to balance, back to what we call homeostasis, right? Back to this place quicker. And that's what we want to see happen. We want to see that your immune system, for example, in the context of pregnancy, you have to have this like split second of what we call a Th1 response, right? So essentially, what has to happen is we have to be able to get blood flow and invade, and then immediately switch over to defending and protecting that little developing embryo that's trying to invade and get its own blood supply and nutrients. So if your immune system can't immediately switch one back, like it can't go back and forth, you won't get pregnant.
And we see that,
And
I was going to say, that's like a
yeah,
Th1 dominant state is essentially a really big factor in both recurrent implantation failure and recurrent pregnancy loss, too.
meaning you can't get back. You can't get back to that protective state. So your body just
so
attacks.
elevated Th1 is not what we're looking for, basically.
Correct.
Right.
It's
Yeah.
so elevated Th1 in the context of pregnancy, you know what? Any immune dysregulation is going to prevent you from getting pregnant. But elevated Th1 is one of the ones that's going to prevent you from having a positive pregnancy test at all. Or if you do get positive, it's like it's fleeting, right? These are early miscarriages. They'll say, "Oh, it was probably genetic or something like that." I'm like, it's probably it could be, but it could also very much be the immune system. And we talk about all different types of cells. So we're talking about what we call in this moment, we're talking about the adaptive immune response, which is Th1, Th2, Th17. There's also something called the innate immune response, which is when we're talking about mast cells, which is the histamine. This is when we're talking about neutrophils, right? So one of the things we look at is the neutrophil to lymphocyte ratio on labs. This has been a marker identified for women with endometriosis. So if you take neutrophils and divide it by lymphocytes on your blood work, if it's higher than 2.5, then your chances of endometriosis go up. So it's a very cheap and easy blood test. But that is an example of a blood cell that we can test and we can monitor. That is also something that's innate. And then the other one that's big in endometriosis is what we call NK cells, or natural killer cells. There is a really significant change in how those cells seek and destroy in endometriosis.
And
Very
same thing, like
interesting.
we'll see higher levels of those. Like sometimes different fertility clinics will do specific immunological testing. And you see those patterns a lot more often in those that have endometriosis, as you'll see like high Th1, you might see elevated certain cytokines, or you'll see high NK cells as well. So then a lot of treatment becomes, how can we essentially suppress and calm down the immune system and some of the inflammation in a really significant way, either through kind of our treatments naturopathically, or sometimes we are bringing on pharmaceutical interventions or recommending and advocating for different pharmaceutical options as well from an immune perspective.
Yeah. And this is where it gets crazy, is it's like you can have more cells that are less effective, right? NK cells should, in theory, clear endometriosis. They should go into the pelvic cavity. They should say, you don't belong here. But we just see dysfunctions at all levels of that. So then going back to Lauryn's very comprehensive overview, when we're looking at the immune system, 60 to 80% of it sits in the gut slash I like, honestly, everyone is always grossed out by this, but your mouth, nose, anus, vagina, it's all a mucous membrane. Like, it all just shares bugs. So we talk about 60 to 80% of the immune system sits in the gut, but it's actually, if we're being very matter of fact, 60 to 80% of the immune system sits in your mucosal membranes. So that's your vagina, that is all the way up, right, into your cervix, through to, like, it's just everything. And so those bugs, whether that is, I shouldn't say bugs, I don't know what to call them. Like, I never like to say your bacteria, viruses, like your mycoplasma, the creatures,
I say
as
bugs.
my boys say. I know my boy at daycare, Aiden will go and he'll be like, oh, my belly is just full of bugs. I think I need to brush my teeth. And like, the
Tell me
daycare
your mom's a
provider's like, what?
naturopath without telling me your mom's a naturopath.
I know, exactly.
So funny.
But in any situation, whether we're using antivirals, whether we're using antihistamines, whether we're using antibacterials, right? We are using herbs to affect a change in the immune system, either by affecting one of those cell types I just talked about, right? The innate or adaptive immune system, which we have a ton of research to show that our herbs can do that, or we are trying to modify bacteria, aka get rid of bad ones, help the good ones grow, get rid of the bad viruses. There are good viruses. Anyways, topic for another day. And we're trying to create balance so that the immune system is not constantly bombarded with a danger signal, which comes from bad bacteria and bad viruses.
Right. And in the context of endometriosis, that will essentially mean more inflammation, more discomfort, more pain,
Yep,
and then also disrupting implantation in terms of from a fertility perspective.
exactly.
And then
Exactly.
would you also get, would that also be something in terms of like egg quality and like genetic, like the genetic material that's required as well? Will that be affected?
Give it LD.
I was gonna say, yeah. So outside of like thinking about the immune system, the other thing, because we know that there is such a high state of inflammation, we do know in the research that it has the potential to impact egg quality, and there's different factors that will impact the magnitude of that, where the lesions are, if there's an endometrioma versus superficial lesions. But kind of thinking about antioxidants and mitochondrial health is really, really important. And there's certain nutrients that have really good research for supporting kind of optimizing egg quality, because we know that those with endometriosis are at a higher risk for having lower egg quality. And even in the setting of IVF, we see poor outcomes in
Yeah.
terms of getting euploid embryos, so genetically normal embryos, or even just how the embryos are able to continue to develop. So do they have sufficient amount of energy that they can make it all the way to a day 5 blastocyst? And you'll see that quite often in the fertility clinics is that those with either diagnosed or undiagnosed endometriosis, that can be a really significant factor that affects the results from the egg retrieval. Sorry, Sean.
No, that's okay. I think that, yeah, it's interesting because you get that notion of endometriosis affecting the kind of physical space of the uterus, the tubes, the ovaries, right? Like where the lesions are, etc. So it's like a,
yeah. There can be a blood flow component too.
yeah.
So then that's going to impact the ability for nutrients to get to the ovaries and the developing follicles appropriately as well if there's altered blood flow. So that's where acupuncture also plays such a significant role to encourage blood flow. But we're kind of from that lens as well, encouraging through our modalities or integratively, how can we optimize blood flow in addition to really specific antioxidants for mitochondrial health?
Yeah, I mean, the approaches and the mechanisms are really, from acupuncture and naturopathic support, they're very similar in terms of what are our goals. Like there's blood flow, there's the immune response, and then there's also the individual who you want to support in terms of stress, any kind of emotional support that someone might need, right? So I think that's really important as well for many reasons, just for a person's ability to get through a difficult time or for fertility journey, but also looking at more the physiological effect that stress and stress hormones can also be having. So that's even kind of multi-layered approach as well, right? And then just looking at the kind of, as opposed to those, like the uterus being maybe like implantation being disrupted because there's a lesion in this place, which is always something they're looking for. But then also there's they're more notion of the environment as a whole, right? Like what's going on with egg quality, what's going on with blood flow, what's going on with these different immune factors floating around in there as well.
I think we're so beyond the days of like a lesion in one specific spot being the issue. As much as I hear fertility
Yeah.
clinics talk about it all the time, I had a patient the other day and she was like, I have a polyp in my uterine lining. And the fertility clinic said, that's why I'm not getting pregnant. I was like, so this teeny tiny little thing is the reason. You know what I mean? There's no other place in your whole uterus that we can have implantation. Not one. You know what I mean? Like, it doesn't make any sense. Okay, if you say there's a polyp in the lining of your uterus, I don't know why it's there. The reason why it's there may be the reason why you're not getting pregnant. Maybe you should see a doctor at Advanced Women's Health or an acupuncturist at Advanced Women's Health so that you can be thoroughly worked up and supported in understanding why that is there. That would be a very appropriate way to go about it. But instead, we say you need to have surgery to remove a polyp because that polyp is the source of all of your issues.
Yes. And that is a story. Oh, that's the wrong way of putting it. But that certainly is something that
Oh, it's a story.
It's a but I mean, I think we have to remember too, sometimes a polyp or a fibroid or sometimes it is the issue, right? So it's still important to investigate that. Would you say? Would you agree? Is it still something that should be addressed?
You make a good point, right? Like I always sit on I spend my entire day, as you guys do, hearing thing after thing after thing that is not aligned with the latest evidence we have. So I will admit and own that I can be a little bit jaded. If you have one tiny polyp and that is causing symptoms, if you are bleeding mid-cycle every month, if you know what I mean, like if it is
Yeah.
causing a disruption in the lining and the lining dynamics, then yes, we are going to have issues and it should be removed. I try to be delicate, but I'm not.
Don't. I think it's important that you're not.
Hammer drop.
I know, right? Boom. We're in a world right now where we have incidental findings and we blame everything on that incidental finding.
Yeah.
We have a society that is more interested in what it can see than what is actually happening. And this is in every aspect of medicine, in life, etc. So if you have a large fibroid, yes, it should probably be removed. If you have multiple polyps, yes, they might need to be removed. Why are they there? Like the thought that we have modern medicine and surgery that can remove something, and therefore that should be the source of all of your issues, is not accurate. Now, that being said, there is something that they will do in fertility clinics, and it's like a scratch test, quote unquote. So they will go in and they will create small amounts of damage in the lining of your uterus. And then the immune system comes into that area, remodels itself, and then people get pregnant. So I think sometimes people get pregnant after a polyp removal, specifically because the immune system has had to come into that area to remodel, shift, and change, and then someone gets pregnant. So I'm not always opposed to the polyp removal, but I don't think it's doing what they think it's doing.
That's really interesting.
Today's episode is brought to you by none other than Advanced Women's Health. If you are interested in diving in deeper to your health, if you are finally ready to feel like yourself, and you are finally over hearing everything's normal, everything's fine, and you want a deeper dive into your healthcare, then we are here to help you. We are currently helping patients in British Columbia and Ontario, Canada. But don't worry, if you're in another province, still reach out, get added to the wait list as we expand coast to coast. We cannot wait to work with you. Check out the show notes for more information on how to get started.
That's my little piece. But I think it's a really important conversation to have, in that there are so many synergies between like blood flow, the immune system, egg quality. So Sean, could you talk from an acupuncture perspective about how you see pain, we've already talked about inflammation a few times, so we won't go too hard into that. But like from a pain, blood flow, and egg quality perspective, like how do you think about TCM in those situations?
Well, I mean, similar to Lauren, like often um, my first way of approaching it is quality of life. Like, how is this affecting your life on a monthly, weekly basis, right? Are you in extreme pain? Are your emotions really dysregulated? Um, are you bleeding for 7, 10 days every month, right? Like all of these things that can really affect um, a person's life, and just how they manage their family and their work environment and everything, right? Like people taking time off work, or so that's almost always how I want to approach it in terms of improving that, right? And so if we can get to a place where that's better, that's a huge win for me. But also the fertility side of things is a little bit, from acupuncture perspective, certainly the expression of pain is really important to look at, because in my mind anyway, it indicates, are things improving, right? So if there's less pain, and if the menstrual cycle is more balanced, more regulated, what you might call more normal, which isn't maybe the best word to use anyway, because there's so many different types of normal. So yeah, looking at different types of pain, and how do we manage that using the acupuncture. And the deeper side of the fertility side of things gets a bit more challenging to assess. But of course, we just have to hope for the best in terms of what's going on internally. Because as an acupuncturist, I don't requisition blood work. I rely on Laura and Sarah and other colleagues to do that. But I'll certainly look at it in terms of trying to get my head around what's going on with the immune response. How is this person's deeper health going on a functional level? But it isn't how acupuncture works, and it probably shouldn't be how it works. It's important to understand that perspective from a patient's experience, but it's not going to really affect how we treat. Acupuncture and TCM is more concerned with how things manifest, how things expressing themselves, right? Like Sarah was saying, the different types of pain, right? If you're getting something that's really sharp and stabbing, that's a particular type of pain that's going to help us choose our points and create a treatment protocol. If it's more of a dull, achy, diffused pain, that's again going to help us choose our treatment protocols. And then we just sort of move forward from there.
And that's the thing I love about acupuncture, and I say this to patients all the time, is to do my job, I have to guess a lot and then get data and the amount of data. So like when you look at the immune system, we have, I don't know, probably a few thousand markers at this point. It is completely insignificant compared to the amount of data we could actually gather, right? What we can look at and measure now is nothing compared to what we will be able to do in 10 years. I am confident with that. And I think that's the thing I love about acupuncture is it's just like, who cares? You know what I mean? This has been in existence for forever. What is your experience of your body today?
Yeah.
How are you feeling today? The more quote unquote complicated you feel, the more lab tests you need, the more things you need to get the diagnosis. Like it doesn't matter with acupuncture. Where are you at? Some people do tongue and pulse, some people don't. But like, what's your experience of your body? What are your experience of these key symptoms? And doing that like head to toe, okay, what's going on with digestion? What's going on here? And that telling the story of treatment. And I think that's why I chose to be a naturopathic doctor and not a medical doctor, is because I wanted to use all the latest available research that I had and my brain. You know what I mean? Like, and be able to integrate it into who's the person in front of me. They're not an algorithm. They're not a diagnostic protocol. We're actually at this point right now. It's really weird in the business where people think that we're like giving protocols, like that every person with endo walks in with the same thing, that I'm like sitting on this cloud above the clinic being like, and every person will get a non-specific type of protocol. And that's not how it works. Like everyone is very specifically treated for them and what's going on with them. Cool. But with acupuncture, it's like the data is the human and you can get great results with just that. Whereas with me, I'm like, is it this shift in the microbiome or is it this? You need this expensive test to tell me if you're not getting better, if it's this or this. Whereas like acupuncture is what's happened in the room, in that patient's body. And how that shifts is telling the whole story, not part of it. And
Yeah.
I think that's so beautiful.
It
Like
is.
your
It's very
profession will never be
cool.
disrupted by AI.
I mean, it's funny you say that. I have heard of someone's trying to invent an acupuncture robot, but we'll see how far that goes.
Yeah, will not happen.
I wouldn't go to it. But I mean, and that's why too, when you're coming in for an acupuncture treatment, it might feel different depending on the day because the points are changing too, depending on where you might be in your cycle. We're trying to support different parts of your hormonal balance, and also, like Sarah said, just how is it expressing itself at the moment, right? And it's fascinating to look at more contemporary research around acupuncture. And so what people are trying to do these days is understand a little bit more why it's working. So we know it works for a lot of things. That's just obvious. But now we're trying to figure out what it's doing on a deeper physiological level. It's helpful for a practitioner to know that because then you can talk to a patient about it and it gives people more confidence, right? About what's going on in treatment. But you don't really need to know, but it's just really interesting in terms of like the Th1, Th2
Yeah.
regulation. Acupuncture is affecting that. It's actually creating more of a balance, which creates a better environment. And then you can take our deeper knowledge of physiology and biochemistry and try to explain why acupuncture is working, right? Same with the stress response, same with
Yeah.
endorphin release, like all that stuff that's happening just with the simple insertion of needles. It's just an incredible thing.
It's the coolest. Like I will forever find professions fascinating when we're like, oh, it works, but why?
Yeah.
You know what I mean? Like we as a culture are so obsessed with knowing like the nitty gritty of why. And I think I am that person, to be clear. You know what I mean? Like I am that person who's like, I want to know every single detail. But the fact that I know I can show up in your office and you can throw needles in my body and I'll probably sleep better and have a better mood and be in less pain and not have clots in my period that month is like, damn. You know what I mean?
Yeah.
It's so cool that that can happen.
Yeah. I know. It's wild. It still blows my mind all the time. So,
So, getting a little bit back into the dirty, nerdy piece, Lauryn, let's talk about this immunological protocol that some of the fertility clinics are exploring. We mentioned it earlier with looking at trying to suppress the immune system. Obviously, like I said, from an herbal perspective, we're getting in there and saying, okay, what is the trigger? Why is the immune system overactive? How can we create stability? How can we fix the gut? How can we support? And obviously, that's the tip of the iceberg in terms of what we're doing for patients. But can you talk a little bit about this immunological protocol and how we are working, advocating with these clinics to better support that?
Yeah, so it depends on the clinic. Some clinics want really specific testing, so that way they're able to see the results and kind of tailor which immunological agents they're going to do from there. Other clinics, because we know that there typically is a significant amount of immunological dysfunction with those that have endometriosis, they'll empirically just do the immune protocol in preparation for a frozen embryo transfer is in the context that I see it most often used. I don't know, Sarah, if I've had the odd practitioner lately kind of use some treatments, which is really exciting outside of IVF, which is a really big kind of window of opportunity, I think, as well, because historically speaking, it used to be only kind of in an IVF setting, but the immunological dysfunction is there, whether you have an embryo in ice, whether you don't, and whenever we can support that without having to have someone go through the process of IVF, or if that's not an option for a variety of reasons, to still be able to support the immune system. But essentially,
I'm actually writing a guide for nurse practitioners on this right now because it's something that I am really passionate about seeing done more often. And I honestly think whether this is you're trying to get pregnant or you're trying to break a cycle of pain, I have seen it helpful. So I am actually in the process right now of just like writing that up and documenting it a little bit more so that more functionally minded prescribers can take action on that outside of an IVF context. So yes, I have seen it. I have to advocate hard. So I've been collecting the research on like why we use prednisolone, why we
yeah,
use like immune or not IVIG, but intralipids,
interlipid.
why we use some of these different agents where Valtrex is coming into the fertility world, etc. So it's a work in progress. DM me if you want the info. But in the meantime, why don't you break down what that is, Lauryn?
Yeah, so normally I see kind of a combination of a cocktail. There's normally prednisone or prednisolone kind of there. I see varying dosages, but normally it's essentially to just suppress the immune system.
Is that, sorry to interrupt, is that a steroid?
It's a steroid, yeah, corticosteroid.
Right.
Yeah. So that's normally, I would say, almost part of a protocol. Then they're most of the time having some sort of blood thinner, whether that's baby aspirin, whether that's low weight molecular heparin, or Levinox is, I think, the name brand. But essentially, there's some sort of like blood thinning or anticoagulant medication that's a part of it as well. Then there's typically like Tacro is a really common. So it's tacrolimus is actually an anti-organ rejection medication. So essentially to calm your immune system down if someone was getting an organ transplant so that your body doesn't attack someone else's organ as it kind of is getting placed in you. They'll use it in the fertility population as well so that your immune system is calm and doesn't attack the embryo as if we're trying to get it to implant and continue to develop. And then the other one would be IVIG, but it's been super tricky kind of to access. So a lot of times they'll use intralipids, which is an infusion that actually also kind of more specifically like lowers NK cells. They'll use it, so those uterine NK cells to calm the immune system as well. There's a big kind of range in regards to what someone's protocol will be, like when do you go for it, in regards to like when your transfer is, and then kind of the subsequent, if you have a positive pregnancy test, like how many infusions. Like I find there's a lot of variability depending on the clinic and what their protocol is. But that would be kind of the fourth component that is kind of wraps up a really standard immune protocol. Other components is they might, depending if they've done microbiome testing, they'll do specific like antibiotic treatment, or Valtrex is, I would say, like that would be something that we're seeing, we're advocating for, especially with kind of how we're seeing the virome impact the immune system and inflammation a lot more. And there's research studies to say that Valtrex can lower NK cells. to support implantation as well. But historically speaking, that often wasn't part of an immune protocol in a fertility clinic, which is kind of really,
Making
really
our
cool.
own.
Yeah.
Prescribing on other people's licenses and making our own immune protocols. But that's the thing with staying up to date on the research, right? Like when I first started practicing, viruses did not cause challenges with fertility the way they do now. It's just different, right? It's just, you have to stay up to date on it.
Yeah, but and a lot of part is advocating, because I find there's a really big range of how accessible some of those treatments are, depending on who your medical doctor is, which fertility clinic, like the access of those treatments. So sometimes it's even just like supporting patients so that they have the information that they feel they can advocate to their clinics appropriately when and if we think that's an appropriate part for their treatment. Because the reality is that going through fertility treatments is expensive. Like it's an investment from a cost perspective. So if we can optimize someone's outcome from the get-go, obviously that's always our goal and our priority, versus, they've been through 3 or 4 transfers and then someone's like, oh, hey, maybe we should look at the immune system. From that perspective. But even just like emotionally and time consuming, like there's so many factors for these couples, like as they go through that process. So when we think there's a bigger immune factor, just having that conversation to say, hey, this is what we think you need, and this is, the information and the resources behind it, and how they can advocate for themselves with their team at the fertility clinic. And it's not easy.
Absolutely.
Depending which clinic they're involved with. There's sometimes really uncomfortable conversations, or they're shut down. So in those situations, it's okay, how can we still access that if we think that is a really important part of your treatment plan?
Yeah, how do we get you out of that clinic? Like that's unfortunately right now, fertility clinics are the wild, wild west. Honestly, there's phenomenal ones.
Yeah.
Phenomenal. Like truthfully, when I see the protocols, when I hear the patient's experience, I'm just like, wow, like that is phenomenal. And then there's ones where patients are told there's no way you have endo without an investigation. There's no, like they're just told no constantly. And it's just like, we're going to do cycle monitoring, you're going to do letrozole, then you're going to do a trigger. This is how, this is what you're going to do. That's it.
Yeah.
Right. And then they say, oh, okay, we tried 3 times, 3 IUIs, 3 IVFs, unexplained, move on. And there's so much more that could have happened at that point. Like, how are we still here with all the research we have? And when I first started practicing, there was like European standards, there was North American standards, but it was kind of like US standards. And then you guys all know I love Australia. So there was like Australia was doing their thing there. And you could predict what someone was going to get coming out of a protocol, aside from like 1, maybe 2 clinics in Toronto that were a little bit more experimental, like doing their thing. Now we have a list internally of who we like to refer to and who we do not. But it is so different. Like even in a 4-hour drive, you can get wildly different protocols. There's so many different influences. There's some that are stuck in their ways and they're like, well, this used to work, so it must continue to work and I'm not changing anything. And then there's some that are so experimental. They're doing PRP, they're doing all of the immunological protocols and treatments and assessments right out the gate. Like it's so vast. And I just deeply feel for patients. And I think that's the one thing I see a lot in my office is the amount of grieving that happens because you're sent to a fertility clinic. You think that they're doing the best they possibly can for you. And in their minds, they probably are. Like, this is not to judge, right? But then you come into our office 2 years and $50,000 later, and we're like, has anyone ever told you about X? Have you ever thought about this? Have you ever, and just the amount people go through. And I have been through that so many times in the last 3 years where the first cycle, we get their embryos transferred, they go to a new clinic, they get the immunological protocol, they're pregnant with twins. They're pregnant with a singleton. You know what I mean? Like the amount of time. And then postpartum, we're dealing with, oh my God, I have a baby. the amount of joy, the amount of challenge that comes with that, and the grieving of like, could this have been possible all the whole time? It's just like I'm in the thick of it with a lot of people right now, whether they're like up to 2 years postpartum and thinking about trying again and having all those feelings come back up. Like it's just so deeply traumatizing that I think that's why we have these conversations on the podcast. Not to say you should get the immunological protocol or not, but to say like you should know, and your doctor should know what it is and know
Yeah.
that it's a very scientifically proven system of medicine that they could choose to explore. And if they don't want to, that's their prerogative, but you don't have to pay them.
Yeah.
Yeah.
So
Yeah, it's
true.
just such a big thing.
It's very complicated world for people, right? And there's no,
Yeah.
it's not like there's a website that has a big chart that shows you all the different clinics and what's offered and different people's experiences.
Yeah.
People it's like choosing a dentist. People just kind of have to hope for the best, sort of, and they just don't know. You know what I mean?
I need to go.
And
to
I
a
do
dentist.
think, and I think that's a
No, I
huge
hear
reason
you.
why coming to AAW Advanced Women's Health is beyond the treatment that's offered. It's also just the knowledge and the experience of how to
Such a huge
navigate,
team.
like how to
Yeah.
navigate that world of fertility clinics, right? Like to get a different perspective, to get some background and some information about what to expect and what to be offered and where should you be kind of going, because people, and then if you need to transfer your embryos from one clinic to another because suddenly your knowledge is built up because it's taken 2 or 3 years, and then there's a whole cost involved, and then there's it's just such a
It's a couple $100. Yeah.
Yeah.
They make it seem like it's this huge thing, and then at the end of the day, it's a couple
Peanuts
$100
in the fertility world.
Put it in a Purelator van, and away you go.
Yeah, yeah. You were gonna say something, Lauren?
No, I was gonna say, like, I know a lot of the other girls on the team are always like, I see a lot of fertility in my practice as well, and they're always like, Lauren, like, what are you doing? What are you doing? And I was like, honestly, sometimes it's not even that there's a different protocol than what, or different supplement plan or X, Y, and Z. I think a big part of it is advocating and like having that education and discussion. Is sometimes that's purely appointments with patients, is like, okay, like this is where things are at, or this is what to expect, or these are your options. And trying to say, hey, you can have some control back, and there's different kind of possibilities here that maybe haven't been explained appropriately, or other ways that we might want to think about this situation separate from, the conversation that you just had with your fertility doctor, and just giving a little bit more context to the situation so that they feel like they have more information, that they can make a decision that feels really empowered and in alignment with what feels good for them, outside of changing, treatments on our end. So I think like us being knowledgeable about how that works is really, really important.
When I was studying to be a doula way back in the day, they launched a new section, and it was called the fertility doula. And it was someone who could go with people to their fertility visits, who could coach them through the 2-week wait, who could be that, like, almost like a life coach, but like deeply knowledgeable about protocols. And the last couple of years, I'm like, oh my God, you know what I mean? Like we need that more than ever. And I feel like I've got a not-for-profit in me at some point, let's be honest. And I feel like a huge part of it is going to be dedicated to just, again, like offering those support systems for people to be able to have access to those deep conversations. Maybe that'll be the next onboarding. We'll do a fertility onboarding and just create a like IVF 101. You know what I mean? The good, the bad, the ugly, the clinics. We can start like a Substack. Is that what people do these days? Is that what kids do these days? I heard it was a Reddit community, and then now I heard about Substack. But some place where we can say the actual truth without getting a cease and desist. I've had enough legal issues.
No name dropping.
So on that note, any other thing? So I guess I'll go each of you. Is there anything else you want people to know about treatment of endometriosis, and any kind of wrap up thoughts? We'll start with you, Lauren, and then Sean will let you take it away to the end.
Yeah, I think the biggest part on my end is, if you're having symptoms, or that we talked about in the first episode, like anything that would be considered that red flag, and you're experiencing infertility, you don't fall under the category of unexplained. And I think that's something that is really, really important because, like you mentioned, Sarah, like when you they kind of just have this broad category of unexplained, you get sent down this kind of tunnel. But there's so much more that we can do to support and explore, and so many different mechanisms that we know can impact your potential to get pregnant and stay pregnant. If we suspect you have endometriosis, and that's with the knowledge knowing that for the majority of people, it is undiagnosed. So if we're working under the assumption that someone's going to have a documented diagnosis in that population, we're missing a huge portion of how we can support and help people, because it just doesn't happen. Most of the time we're working under the area of, hey, you have these symptoms, this is what we think is going on, and going back to how do we think physiology is impacted, because regardless if there's that label or not, this is how the systems are at play, and this is where we need to focus on in terms of treatment to get you get you the outcome that you're looking for. And I would say, like, most of the women that I'm working with, they have this gut instinct, right? Like, most of the time they'll be like, I know something's off here. And like, there's so much research that is accessible and information that's accessible that they come in and they've done, and they're like, I'm pretty sure this is, this might be a factor for me. But I don't seem to be getting anywhere with it on my own. And we're like, hey, okay, I hear you. And we're going to help you navigate that differently. Yeah.
Yeah. Amazing. And Sean?
Yeah, I think, I agree with everything Lauryn said. And I do think, too, it's important to get a reading on your doctors in terms of, like, are they willing to support you if you're getting other types of treatments? There is a bit of pushback and resistance there sometimes, which I don't think is useful for anybody, because, you just want that. You want things to be integrated. You want everything to be supportive. And I do think that acupuncture is absolutely worth exploring for endometriosis for a lot of reasons. If you are seeing someone with acupuncture, they should be using a TENS machine during the treatments, especially when we're talking about pain and blood flow. So that's just something important to think about. And if you are seeing a practitioner, ask them about that. Yeah, I think it's worth it. People should be opening up their minds in terms of what they can use to support themselves.
Yeah. And I know I've said this before and I'll say it again. I deeply understand when people are terrified to put themselves in a vulnerable place of believing that something else can help them. Like, it is really scary to believe that something could work for you, because if you do and it doesn't, there's a possibility of even more disappointment, which that heartbreak doesn't always feel worth it. And I want to hold space for that and acknowledge that, but also acknowledge the fact that we have had so many success stories from people who felt the exact same way. And we are a clinic full of people who care about the latest research and care about the results. Not that other people don't, but I'm just saying, like, there's so much thoughtfulness, there's so much caring. We want to create an experience where you can get your results, whether that's from an administrative perspective, the doctors, how we work together. Like, all of those things are just so critical to how you go about getting success. And if you want to have a meet and greet and talk to Sean or talk to Lauryn first before you dive in, before you get your hopes up, do it. Like, do whatever you need to do. Ask for whatever you need to ask for to feel confident enough to put yourself in that situation, because obviously we can make no promises, but my God, it brings me to tears on a regular basis how often we have patients that were given, like, the no hope diagnosis who get pregnant and who carry to term. And, like, there's so many things. Like, even I was talking to a patient yesterday, and she had such a traumatic birth history, and her baby was born last week. And it's just like, you're worth taking that, and you're worth asking for the support that you need, whether that's a meet and greet or like whatever that is, to start having some of these conversations. And I really just, for me, like that's the thing I wish more people did, is just stay curious and ask. And if you're feeling aligned, if you're listening to this, share it, like send it to a friend. There's so many things you can't do that we feel so nervous about doing in a fertility context, about helping someone, you know what I mean? Or like what to say, what to not say, like how do you navigate that? You can send them something. You can send them a resource and be like, I don't know if this aligns. It might not. I thought of you. Done. Right? And sharing that message, I think, is one of the most powerful things we can do right now.
Yeah.
Cool. Well, thank you both for coming on. Such important topics. We will do more of these collaborative podcasts because I think it's such a great way for people to get to know how we can support them. If you want to know more topics, if you want to hear Sean and Lauryn jam on other topics, fire us a message on Instagram. We're happy to support. I'm happy to support on their behalf. But thank you guys so much for coming, and I hope everyone enjoyed. Have a great day.
Thanks. Bye.
Thank you so much for listening. I hope that you had as much fun as we did. And if you loved today's episode, share it with a friend and leave us a review. That is how we spread this message, and that is how we are going to revolutionize healthcare in Canada for women. Have a beautiful day and be well.